In Arizona, the VA clinic had a secret wait list for people. They told people to come back later for care, and people died on that wait list. It was covered up. The media didn't want to criticize it because they knew Republicans compare the VA healthcare system to other government-run healthcare systems. But the fact of the matter is, U.S. military veterans died waiting for care that the government had promised them and didn't follow through on those promises. That's shocking, and it is an example of what would happen if we completely remove the private sector from healthcare. Another thing that would happen, Justin, and I think this is a widely overlooked element of this, is the innovation that happens in our healthcare system. People come to the United States from all over the world because we are the best of the best. We have cutting-edge technology because there is a monetary incentive to create that, to explore that, to research that. Listen to this statistic. 87% of new drugs in our country come from the private sector. Only 13% come from government-funded research. Imagine a healthcare system in our country that removed the private sector. 87% of those new drugs, what happens to them?
Yeah, absolutely. I mean, presumably, if Senator Warren gets her way, the federal government, which again can't even deliver the mail without running a $3 billion deficit every year, would take over running the drug manufacturing industries, or at least much of it. The truth is that the United States healthcare system has a lot of problems. There's no question about that. But most of those problems are because of government, not because of the private sector, not because of health insurance companies. That is all crap, frankly. There was a study recently done by, I think it was Tufts University, where they found that, you mentioned drugs earlier, they found it cost $2.7 billion to produce a new drug, and that it would take several years to get through all of the bureaucratic red tape at the FDA. Okay, so even with all the innovation we have, we could have more if government got out of the way and allowed individuals and allowed entrepreneurs to embrace their ideas and to innovate and to try new things. And the government just isn't set up to do that sort of thing. That's why they're so inefficient at everything else that they do. And when they run into trouble, they don't innovate. What they do is they ration. And we see that all over the world. We're seeing that in the United Kingdom, where just this past year, there was a report that indicated that they were going to ask people to start going to primary care visits in groups of 15 people if they had chronic illnesses like diabetes. Because of course, who doesn't want to talk about their erectile dysfunction or their diabetes in a group of 15 people? Yet this is the answer every single time. When government gets into trouble, they don't cut spending, they run up debts, they print money, and then they ration care, and it hurts the poorest among us more than anybody else. I mean, that's the reality. And regardless of what Kamala Harris says, that's what's going to happen if we have single-payer health care in this country.